I'm Shauna Nyros, and I'm your host of the Wealthy Podcast. Today, we are talking to Allison Young, who is the CEO of the KGH Foundation. We talk about why wealthy, and we talk about the expanding role of healthcare foundations in 2024, as well as we get a little bit personal with Allie and her leadership journey. I hope you enjoy this episode. All right, well, here we go. Episode 1. This is so exciting. Today, I am sitting with Allison Young. She is the Chief Executive Officer for the KGH Foundation. She is a founding board member for AFP Okanagan. Your bio is really impressive. She is the BC representative for the National Council for the Association of Healthcare Philanthropy. She's vice chair of AHP. And she's also an alumni of Carleton University Academic Master's Program. Wow, that is impressive. She is also my leader and my friend. And so I'm super excited to be having this conversation today with Allie. And this is our first episode of Wealthy. And I'm so excited. I'm a little nervous. How are you feeling?
I'm totally nervous. Yeah. Yes. But very excited, really excited.
So we've been talking about doing a podcast for a while, actually. You came to me a couple of years ago and in true Allie style, super excited. You were like, I have this great idea. We should do a podcast. And I was like, I'm not sure. And here we are. So tell me a little bit about why even 2 years ago, you thought this would be a good idea.
You know, I really love that you think it was my idea. For some reason, I thought it was yours, but maybe that's just because how we tend to work together. And I love that we can dream things up and that we find ourselves, even if it is a couple of years later, actually doing it. And I think that really reflects the spirit of our organization. So for me, a podcast, why a podcast? There's two different things. More and more, we're recognizing that we have conversations with amazing people. And we often say, if only other people could hear and be a part of this conversation. And, in thinking about what our role is as an organization in this community beyond, fundraising, it's about engagement and supporting conversations between people, between organizations. And what if we had a platform that we could really sort of amplify those conversations and those voices? So that was one. And the other, I would say, as an organization, we have to constantly be innovating and thinking ahead. And it's you that says all the time, media is changing and the way that people get information is changing. And I like that we're leaning into how we might be able to share a message in addition to traditional media, that will appeal to people in a way that's super personal for them. So I like that the foundation will be a part of a bigger conversation in people's homes.
Yeah, I'm super excited about it. As you know, one of my goals in life is to be Oprah. And so I
actually didn't know that.
You didn't know that?
No, I do.
Yeah. I've often said to Phil Johnson, I want to take his job, but he's safe for now because now we get to do this. So yeah, I agree with you. We do have to adapt to, the changing world that we're in. And the nice thing about having a podcast is that we're able to have these longer conversations and get a little bit more in depth. And the cool thing about Wealthy, I think, is that, it's kind of not what you would think we would be doing, the KGH Foundation. We're a philanthropic organization, we're fundraisers, we are conveners, like you said. But this podcast is going to be a little bit different. So maybe you can sort of share what the vision or the goal is for us in terms of content and what we'll be presenting.
Mm-hmm. So when I think about our work, everything you just said is the investment that we make in relationships and brave conversation. But there's never really been a container. How do you share that? I often will say to you, I'm like, put me in front of anybody and I will have a conversation. It's like my heart can show up in that. I can have a good sense of who's in front of me and we can connect on something that matters to both of us. And so I think for Wealthy, and I love the way our team came together, and it's like, what do we call this? Why are we doing it? It's an opportunity for us to lean into the conversations that people want to have. When they think about health and they think about healthcare, so often the questions go beyond sort of maybe what's happening at the hospital or what they've experienced. But it's like, how do we think differently about these big issues? How do I contribute? How do I sort of be a part of that bigger conversation? So I think that's where Wealthy can help support that. And then the name, I remember when that first got put on the table by one of our team members, and everyone kind of went, oh, that's a bit uncomfortable, fundraising organization, philanthropy, Wealthy. And very quickly, though, we came around to that idea of no, let's lean in. And what is wealth? And I hear probably every week, people will say, time is everything. My health is everything. You don't realize how important your health is until you don't have it or until something threatens it. So true wealth, when you ask people often, they won't talk about their money. They won't talk about even some of the worldly successes they've had. They'll talk about time with their family. They'll talk about the fact that they wake up and they feel strong and healthy and connected. So we realized we had a chance to lean into that space and start to redefine how people think about wealth.
Yeah. And also, I love that. And also our role in our own health and the fact that health, the definition of health, thankfully, is evolving and it's far more nuanced. In the past, we sort of think about health as like, oh, like, am I physically healthy, right? I'm not sick or I'm not injured. But now we know that health is comprised of so many different aspects, right? Mental health, social well-being, connectedness, all of these things play a role in our overall health. And I guess the proposal that we're making is that wealth is, the conglomeration of all of those things, right? And that's what determines whether you're wealthy. And we can play a part in that, right? As individuals, and then even just hosting this conversation. So super excited about it. So we were sort of thinking about how we could start a tradition maybe on this podcast with our guests, like an opening tradition. So I'm going to start with you because you're our first guest.
Perfect.
And it does relate to health. So can you recall and share with us kind of like the first moment when healthcare significantly affected your life or that of someone close to you?
Mm-hmm. Two things come to mind for me. I grew up with a mom who was also a registered nurse. She worked in the emergency department, pediatric emergency at Alberta Children's Hospital. And I found her job really interesting and the environment that she worked in really interesting. She worked nights often, so how that impacted our family and just recognizing and assuming that what she was doing must be really important because if she wasn't going to be at home tucking me in, she was out there helping kids. And it was funny too, because I would wake up at 7 a.m. for school and my mom would be like screwing a bookshelf into the wall and be like, what are you doing? Well, she had experienced something the night before, child had come in injured. So the way that sort of her work environment translated into our home, you also had to be deathly ill to stay home from school if you were sick. So all that to be said, I would go see her at the Children's Hospital and just be really curious. And maybe without knowing it at that time, it was like someday I'm going to be a part of this big environment. Years later, of course, becoming a mom, health takes on a very sort of different definition. And both of my boys have had health journeys where we've been significantly impacted as a family. And we've had to travel for care. Both of them, the type of care that they required, we had to go to Vancouver, spending weeks, away from sort of friends, family in a city that is beautiful, but it's not my home. At the time, and for one of our journeys, I was a single mom, so financially figuring that out. But I remember sitting with the healthcare team, and maybe that was also another pivotal moment where it was less about the fact that my child was sick, and it was more about what it was going to take to get him better. And it wasn't sort of one doctor or nurse or sort of medication or treatment. It was about this journey and the people around me to get us where we needed to be so that I could bring him home. And we could carry on with the things that we like to do that didn't involve him being sick.
Yeah, I can certainly relate as a mom, and also as somebody who's kind of navigated my own health journey and challenges. Yeah, it's when you don't have it, when that medical crisis arises, it's like everything else stops. It becomes the most important thing, and I think that's why these conversations are important. And I feel just as passionately as you do that the work we're doing at the KGH Foundation is really valuable. So I'm going to kind of transition then a little bit, and let's talk about our current campaign. And just to preface this, this podcast isn't going to be always talking about campaign and, funding commitments that we're making. But I think it's really important for people to understand where we're coming from in the context of all of this. So maybe you can share a little bit about the Closer to Home Than You Think campaign and kind of like your vision that brought that to life.
So I think looking at both the campaign, but also maybe the evolving vision of the organization. So less about what we're fundraising for, but more about our expanded role in health and healthcare and where we recognize we need to be. And, with support from our community and our partners, we're well on our way. A new era, or closer to home, it really was the outcome of us thinking about where health was going. We were dreaming this up during COVID, and that was tough for everybody, where we recognized that good healthcare is a lot more about people and solutions and innovation as much as it is, I guess, to say, the type of equipment and the services that we get if we arrive at the hospital. So when we were thinking about where are we going to go, how are we going to create value, we knew that we needed to support excellence at our hospital. We'll always do that. We have a legacy of doing that. Our community has helped us literally build the hospital that we have in Kelowna that serves all of the Okanagan and all of the interior. But we also had to start leaning into conversations with medical leadership, with administrative leadership, with the health authority, with healthcare providers and community, and say, how can we, as an organization that is really good at relationship building and raising money and telling stories, help contribute to the advancement of healthcare and, at this point, the future of healthcare, because things were feeling really broken. And so that started to shape the campaign that we're in today, which is help us support excellence at our hospital, help us support care and community. And what underpins all of that is through supporting people and relationships. And from that, without even meaning or intending, it started to shape the entire sort of future vision for the organization.
And I love what most people don't know is that initially, before this campaign was named Closer to Home Than You Think, we had a working name for it, and it was A New Era. And that really was kind of a pivotal perspective for us to take and allowed us with the space to kind of just like blow things up and be like, okay, so this is the way that it's always been done. But if this is a new era, what could be done differently? And it was a really cool place to start the conversation. I'll never forget we had a conversation early on about, during COVID and in the aftermath of COVID, a lot of the stories that we were hearing about healthcare were just so negative and disheartening. And it was almost like, gosh, like, what are we going to do? Like, this is hopeless.
Yeah.
How are we ever going to get out of this and get to a place where we have a not even thriving operational health system?
Mm-hmm.
And I remember you saying, let's stop talking about what's wrong and let's start thinking about what it would look like if it was right. And I really loved that. As somebody that works with you every day and somebody on your team, it was a real shift in mindset. And I think it like infiltrated everything that we did. So to get a little more specific, Closer to Home Than You Think, the campaign is pretty novel. It's novel for us, but it's also novel, I think, for hospital foundations. Can you maybe kind of unpack that novelty a little bit and share why it's so different and so cool?
Well, one thing I'm learning is what comes with so different and so cool is a lot of discomfort. Because I would say that there are traces of what we're doing, happening across the province, across the country. We're all trying to think about how do we approach our work differently? How do we approach our organizations, relationships differently? So for me, it was witnessing that. And to your point, I couldn't engage in conversation anymore where at the end of the dialogue, there was no way forward and there was no solution. And I remember thinking, if we can't find hope, then what is there? And then starting to build upon that. So I think what's really exciting about this is we have very concrete, important investments that people can make in the infrastructure of, the hospital and of the services that are provided there. They can build on, government investment, and they can take something that, hopefully in most cases is good and really, really make it great. But in addition to that, we can work with people to, on the medical side, support them in being heard. I can't tell you how many folks will sort of leave our office and say, it just feels good to be heard. I've got ideas, I've got challenges, but I also believe there's a way to move through it. And just to know that you're listening, I leave here feeling hopeful. And I'm like, how do you share that back to the community? Like today, because you believe in us and we're able to support this individual, you've created hope. You've inspired solutions. We can maybe show evidence of that down the road, but that hope is what keeps people moving. It keeps them showing up. I think that's the same for us in our organization. So and then in that is when you start seeing innovation, because when people feel heard and they feel hopeful, they start thinking beyond the box or what they can see. And when I think of the context of healthcare, and I think this could apply to sort of a lot of different areas, we need that because the box we're working in right now, isn't serving the needs of our diverse communities. It's doing its best on an individual level, but it's complex. And so the best way I think for us to make change is person to person on kind of a grassroots level, holding some hard, big conversations, and then sharing back to our community and to those who sort of join us on this walk, what's possible when we work together. And I don't know if I answered your question there, but that's what I think is novel, because I can't tell you exactly what it's going to look like, but I can tell you what it's anchored in.
Yeah, and I of course that's a great answer. You mentioned innovation, and a significant component of this campaign. So prior to Closer to Home Than You Think, our campaigns usually were anchored in a specific piece of equipment or increasing capacity for a particular area of care, like cardiac care or stroke care. And our goal was sitting around 8 million. It seemed to be sort of the happy place for us. Then all of a sudden, Allie Young assumes the position of CEO, and we go from 8 million to 40 million. And it's not just about equipment anymore. There is a $15 million commitment to innovation. And I think what you've just described is why that commitment is so important. And it's about enabling the creativity and the time. You know, we talk about buying time for physicians and clinicians to be able to think about how to do things better. And often, rarely, they just don't have time. So tell me a little bit about what that $15 million commitment to innovation actually means.
It involves a couple different things. I think sort of most importantly, it's reversing the relationship that philanthropy typically has with anything. But of course, in our context, it's healthcare. So if you use the example of stroke care, we required a really incredible piece of equipment and investment in training so that we could implement a program here that was really needed. People were having terrible outcomes when they had a stroke. So that is the immediate need. We know what the equipment is. As soon as it, gets put into operations, we're going to be able to have a significant impact on patients who are having strokes. What we also know is at this very moment, there's medical leadership who are looking at new drug innovations or interventions. They are looking at how they can better transport people from across our diverse region geographically. It's like huge. How they can get them here more quickly, better, so that they can have better outcomes. And these ideas are constantly generating. So at the time of raising funds for stroke care, if we had raised the $4 million for the equipment, we would have done a good thing, and community would have done a really good thing. But if we thought bigger than that, and through conversation, so it's not just like a hope and a dream, it's these ideas are in motion, and with some resource, with some time, with support, we can move these things into practice even more quickly. So to look to donors and say, support what we know and support what we know is coming. That involves a lot of trust. And that's a different way of engaging. And that approach is what then we scaled up for a new era. 40 million is big, but how do you go to community and say, healthcare is harder than it's ever been? People are tired, they're bruised, we have problems that are so complex, and we're going to raise $5 million for a piece of equipment.
An MRI.
An MRI, which is very important,
yes.
And we need. But we need to be bigger than that. We need to think and dream bigger than that. And we wanted to give community an opportunity to invest in hope, invest in solutions, and then commit to showing them the results of that. So it's this building on trust that we had, but continuing to expand on that. And it has completely transformed, I think, I know how we do business and how we engage with our community. And I'm hearing from folks in industry that they too are starting to lean into this type of engagement work.
Yeah, and I think it was a brave proposition for sure, and certainly not without risk, because one of the big question marks that we had was, will our community and donors support,
ideas,
mm-hmm. And possibilities?
Yes.
And so what has been the outcome so far?
One thing I want to touch on, because this is another thing that comes up a lot, and more than ever, I think people are looking to have agency in the kind of care that they are being provided, but people are also hurting more than they ever had because of how challenged the health system is. Government, I'll often hear from people say, shouldn't government be funding these services?
Ask about that.
And I bring that up because I think it helps us build upon something. So government is very important for the investment in infrastructure, for helping to build hospitals, for funding the services and the operations that happen inside those buildings. So they play a very important role. But government alone is not going to be able to create the type of healthcare that you and I, that we want for our kids, for our neighbors. We want to ensure that healthcare is accessible to us, that it is as close to home as possible. So government will will invest in quality and ensure that you have access somewhere to the healthcare that you need. Philanthropy invests in excellence. Philanthropy takes a building that's built and it makes a hybrid OR, the trauma suite. Philanthropy invests in the medical leadership who bring new ideas and new procedures to our area so that we're not just getting good healthcare, but we're getting excellent healthcare. So the results that we're starting to see, and we've got so many that I could talk about. I'll give you one example, and I know he's going to be coming onto the podcast at some point, so I won't jump in too much. But we recently had a cardiac doctor share with us that philanthropy saved this patient's life multiple points on his journey in community because of investments that were made in BC Ambulance, at our hospital because of investments that were made in cath labs, again at our hospital because of investments that were made in our critical care cardiac units. Government built those spaces. Government funds the operation, so we can't minimize how important of a role that they play. But philanthropy made sure that that advanced cath lab was available to help save this individual's life. Because if he had to go to Vancouver, his outcomes would have been very different. So there's an important recognition there, I think, for people to understand. Government also responds, what we say is, downstream a little bit more. And philanthropy can sort of pull things back, and we can start making investments in community and in health prevention, promotion, like kind of what we're doing here. Like, I hope maybe one day somebody will hear something on this podcast that will trigger a conversation they have with their doctor that will maybe potentially prevent them ever having to come to our hospital. So there's an example of what I think is starting to happen, in addition to sort of the physical evidence that I could show you if you walk through the hospital.
Yeah, it's exciting, and I'm going to ask you a little bit more about sort of the relationship between hospital foundations in general and health authorities or government, because I think that's one of the things that people, it's kind of like the biggest thing we overlook sometimes, I think, as hospital foundations, is that fundamental question, like, shouldn't the government be funding this? And you've spoken to that, but how does it work? Like, how, and I know you're not the expert on this, but I know you interface with our health authority all the time, like daily. How do they make decisions about where funding goes? And how does that all work?
That's a really great question. I'm still learning. It's complicated. There's a lot of factors at play. The health authority works very closely with the Ministry of Health. Ministry of Health has a duty to the citizens of this province to ensure quality healthcare is delivered throughout the province. It's a big geographical space. There's a lot of people. Our needs, for example, in the interior, how we access healthcare, community members living within the interior of southern BC is very different than how people access healthcare in Vancouver or on the island. So there's, I don't think any of us should minimize how complicated and big it is. And I don't know if there's any perfect way to do any of this. But there's certainly a relationship between the Ministry of Health and the Health Authority, and the Health Authority is responsible for organizing services in our region. There's 5 health authorities. So for us, Interior Health, they're responsible for ensuring the sustainability of those services, the quality, the safety of those services. You pull on any thread, and it's connected to a lot of different things. We work closely with the Health Authority to understand how we can help potentially advance something that is a priority, but there's not currently funding for it, so we can get it in our community more quickly. We will look at how we can support sort of an existing initiative like stroke, for instance. They worked for operational dollars. They worked to make a lot of other capital investments. We were able, with donors, to purchase that equipment and then also to establish that innovation fund so that program's not just here, it's here sooner than it would have been, and it's thriving. Yeah. And so it really requires continuous conversation, continuously leaning in. I would say that our relationship with government continues to evolve, and we look for ways that we can either support, that we can participate, or sometimes where we can lead.
Ali, you're quite outspoken, I think, or becoming more outspoken about the role that hospital foundations can play in advancing healthcare. And you've given some really great sort of applications of why, or the place that philanthropy fits in all of this. But maybe you can just share, where do you think hospital foundations and even, the KGH Foundation as point of reference should be focusing their impact?
Mm-hmm. So I think that we always have to prioritize and sort of maintain our commitment to what's happening in hospitals. Ideally, hospitals are where you go when you're very sick, very injured, a trauma, or you require specialized care. So that investment will always be a priority for us. And I think it's critical that we make more investment, we have more presence in community. So caring community as a way to keep people out of hospital, because we all are hearing, you go to the emergency department, you wait forever. There's not enough doctors. How do we access care? And so we have a commitment to meet people and support caring community. And that's something that continues to evolve. And I know it has to be an equal priority. It's going to take us time to develop those partnerships and really understand what our role is in that space. But I can tell you we're already there. We're on the ground. We have conversations with health providers that are part of the Health Authority, Interior Health, but also health providers like Canadian Mental Health Association in Kelowna, Child Advocacy Center, the YMCA. A partner like the YMCA, where we can use some of our superpowers, connect our community and our donors to programs that the YMCA delivers on our sort of commitment and promise. That is helping people experience a better quality of life. They're able to have more control over their health outcomes and how they access care. And they're actually best served in community. That there's a lot of examples where people come to the hospital and it's not actually the best place for their care. So I feel very passionate that we are not just a health care philanthropic organization. We are a health and healthcare. So serving our hospital and our community. And I would bet the more presence that we, and I hope other hospital foundations have in community, the more we're going to see this sort of upstream effect. And it's going to position our hospitals to do what they're supposed to do really, really well, which is specialized care and surgery. And so that's a big shift for us. And then the other shift that I would say is our voice matters. And the voices of the people that we talk to matter. Folks think that the hospital, Interior Health, everybody that works in that ecosystem is the government or is Interior Health. That's not true. There is medical leadership, health providers, researchers, policymakers that are their own little sort of independent part of that bigger system. And the more that we have brave conversations with those people, the more that we work together with them to try to also sort of drive the solutions that they're looking to move forward, the more that we're going to see a greater impact on overall health in our community.
And so if I'm understanding what you're saying correctly, basically being able to provide an opportunity for physicians or clinicians, medical leadership, to share their ideas and work with the health authority to advance those ideas, because we have access to resources, is just as important as we move forward as sort of the traditional way in which we've operated in relationship with the health authority, which is, here's the health authority's priorities. This is the list of equipment that we need. What can you help us with? Right?
Yeah, I think you hear a lot about sort of the traditional approach to whether it's healthcare or leadership, this sort of top-down approach where sort of solutions or priorities are identified and then they trickle down through the different layers of our organizations or communities. And often when they land on the ground, even if they're well-intended, the application doesn't quite fit.
Like it's so far from the source.
It's so far from the source. And, going back to how diverse our province is and the communities that make up our province are, there's a tongue twister. I think, and I liked how you said with our health authority, with our government, the other conversation for me that can be very challenging is when individuals blame others. This is a government problem. This is a health authority problem. This is a doctor problem. This is a you, me problem. This is an us problem. And so it's going to take us to also figure out solutions. And so I like the idea of understanding how we can work with government, what the big priorities are or the big challenges that they're trying to solve, and provide sort of grassroots solutions and find a way to meet those in the middle. Because there's no shortage of ideas. If you spend a day sort of next door in this hospital, people got some really great ideas. Those ideas alone, without resources, support, or sort of a way to plug into the bigger picture, won't necessarily get us to where we want to go. I do think it's critical, though. Sort of those decision makers at the top need to be listening to the boots on the ground. And the boots on the ground need to be invited to a table where they can have an understanding of the challenges or the complexities that decision makers are having to sort of work through. For us, I think we have the opportunity to amplify what's possible at a grassroots level in our community and find creative ways to take investment that's coming from the top or sort of opportunities or strategic priorities that are coming from government and say, we'll help you marry the two. We'll help do things in this community that really matter. It might look different in Vancouver, but here this will make a real difference and we can do it with you so that we're all walking in the same direction, which is ultimately, I think, what we're all looking for is sort of let's get there, wherever there is, together. I could go on forever.
I know, and I love it. I want to ask you about what that means in terms of not just patient care or like people care, because we are talking about upstream solutions as well. But I've seen this. This is why I fell in love with not-for-profit and working at the hospital foundation is like when you include community as part of the solution, what happens?
Magic. It's everything.
Yeah.
I feel for whatever reason, you hear all the time about silos. One, left hand's not talking to right hand. We have it in our families and communities and big systems. The more I think that we can all come around a table and we can talk about from like an abundance mindset. That's the other thing. There's a whole conversation we could have about scarcity versus abundance. But when we come around a table and we involve, so in the context of healthcare, the health authority and the sort of knowledge and responsibility that they have, physician and the commitment and the aspirations they have. along with patients and families who are experiencing care and often have really good ideas on what might look better for them and then potentially the system, include us, where we are having dialogue with many individuals who experience that system. And we put a question in the middle of the table. The solution or the conversation that's going to happen with that group, I would sort of 100 times over bet on that solution than I would of a solution that comes out of a room that has one or two individuals who are responsible for one thread of the system. And so community is everything. And the other thing I think it does is gives community a sense of agency, right? And I mean, we talked about hope, but agency. I can help influence the kind of care that matters to me. I can help share what challenges I face if I live in a smaller community, or if I have cultural differences from maybe the person who's providing me care. We can come together and we can understand each other better so that we can work towards, again, whether it's solutions or a better way of being. And I think community voice in that is everything.
Yeah, I love, I'm very passionate about our role in providing people agency because, like I said, there's a lot of dialogue about what's wrong and what needs to change. And that can feel very disempowering. I think about even, personally, my own health journey. You can feel pretty helpless as a patient when you're relying on a system. Mm-hmm. But to be given the opportunity to have an influence on that system, which is, I think, fair to say. Like, I do feel like when an individual or person gives to support an area of care that they believe in what we're doing, they are influencing care. And I think that feels a lot better than, everything is broken. The government has to fix it. We hear that all the time. I don't know, maybe it's just me, but I feel so much better about a world where we work together. Maybe it's not perfect. We're not going to solve every problem. We know that. These problems are complex. But like you said, working from that grassroots levels, like, okay, what can we solve today?
Mm-hmm.
And just have an impact on one person's experience. It's enough.
There's a lot of work we still need to do, because I agree with you, as individuals and as patients and as families and community members, we are ready to have these conversations. I think, in healthcare, you've touched on it a couple times, it's a journey. So like right now, we're in the midst of launching our cancer priority in community. And, I go back to, whose job is it? Whose responsibility is it? Well, when you were a cancer patient, you really didn't care who was funding what organization was responsible for what element of service. If we call it community care, if we call it hospital care, if we call it cancer care, you just wanted to know that you were being held and that you had access and that you were going to be okay. And that's another conversation that we need to get
in a timely way.
In a timely way.
That was a huge part. Yeah.
We need to get better at that as fundraising organizations, as health institutions, that we more and more look at sort of that patient-centered, person-centered experience. So when I go to community and say, help us support the cancer journey, let's worry less about sort of who does what, and let's just generate as much support as we can for that entire system and work with those organizations that are responsible for different parts of the system and make the care that people get here, and I mean, folks across the province and country are trying to do this too, the best it can possibly be. So there's this idea of like, I am over, and I think a lot of people are, cancel, which is very toxic culture of pointing fingers, of blaming. And I'm all about, and same around like scarcity mentality. Okay, if we raise money for this, is it going to put one of our partners in a bad position? If if something happens in Kamloops, does that mean Kelowna is going to go without? I think there's enough to go around. And the more that we kind of lean into each other and we work together and we figure out how we can like leverage our strengths and do more together is where we're going to start seeing the real change. And I can't even remember what the question was, but it got me thinking when you were saying these things. And I don't want to suggest that we don't still have a lot of work to do. And on a daily, my appeal is, can we just come to the table? Because what I do well and what you do well, together we could really complement each other. I don't have to do what I do at the expense of you. And I think people in the system are trying to have those same conversations.
Well, that's the abundance mentality that you speak of. And I really appreciate that is the lens that you approach your leadership in all of these really sticky issues. It's not all sunshine and rainbows. It's complex work, and having that lens of, let's look at this from the perspective that there is enough to go around, and that if we truly and genuinely have an intention to work together for what's best for the people who live in these communities, that's where those solutions will come from, right?
Mm-hmm.
I love that.
And that's really a reflection of your leadership style. So I'm going to kind of transition a little bit away from sort of like healthcare topics and talk a little bit about you and about leadership. So you've been here for 2.5 years. Maybe you can share a little bit about how you got here.
So how far are we going to go back? I've done that before.
Far as you want.
Where someone's like, so tell me how you got here. And I'm like, well, so I've been with the foundation for almost 8. You and me started right around the same time.
Yeah.
Yeah. And, if I can think about, I'm going to start with how I found myself in philanthropy, because I would say for me, there's always things in life that occur that sort of help guide the path that we take. But on an individual level, no matter what was happening in my life from the time I was very, very young, I believed that like change was possible. If I just like believed enough and I committed myself that I could change things. So whatever that looked like when I was, 10, and then sort of as I got into my 20s, what I found really incredible when I started to step into what I like to call the social profit sector or the nonprofit sector was I was surrounded by people who had a similar mindset of change is possible. And I also was very attracted to the fact that it was a very like working together. Whereas the profit sector I'm very entrepreneurial. I love dreaming big and coming up with sort of ideas, but it can feel very individualized. It's sort of for, the benefit of a few. And I love the profit sector and I think there's a lot of incredible genius that comes out of that. And I really love the people who have prospered and share back with the greater community. And it's one way to approach community change for sure. But for me, it was finding myself now in the sort of presence of people who had this collective belief too, that change was possible. And I saw more and more this sort of working together that would translate into great things that had value for a lot of people. And that just like filled my heart up. I am wired for connection. I think we all are, but I might be a little bit on the high side for that. And relationships are everything to me. Like if I show up at a table and I discover that somebody has no interest in like connecting, it kind of discombobulates me a little bit. I have to really ground myself in those moments. And I've had to learn to be more strategic in those moments. But so I leaned in all the way. And this would been probably my late 20s. And in the Okanagan, I was fortunate to work with a couple of really great organizations that helped me hone skills in this space. And I discovered that, my relationship building could be translated into team building. And I found I did that well. And then from that, when I was with the foundation and our previous CEO decided to resign, I decided to put my hat in the ring. And I thought, what if I can translate what I've done with my team to the organization? And I had already been dreaming for some time about what was next and what could be possible. And so it was, there was 100 moments that sort of led to this one here. But as I now look back, it was all leading me to exactly where I am, I think.
And I think one of the things that makes you very, just an interesting human, is that this path for you was not easy. You're such an optimist, and I know you like to see sort of the bright side of things, but I know you as a friend and a person, and you've had to navigate some pretty tough stuff while building a career. Do you want to talk about how that's sort of influenced your drive?
I would say, so when you talk about tough stuff, we've all got a lot of stuff in our little red wagons, like Shauna like to call it that.
Yes.
That's Shauna's term, but I like it. We're all complicated people. We've all come from sort of different backgrounds and upbringings. But for me, I think, in relation to my career, I found myself to be a single mom pretty early on. My boys, I have 2 amazing boys, 3 also very amazing stepchildren, but at the time it was me and them. And I would say that my drive came from a desire to support them.
You're right.
And to really practical. I needed to give these boys more opportunities than I had. Like hell, I was going to have them face any barriers because their mom was a single mom. If I was going to be working, so yes, I loved the nonprofit space, it had to be for something that was going to create a community that was going to be better for them. And then a lot of it too was like, I still had my own curiosity and my own drive. And I knew that I needed to continue to educate myself and invest in myself so that I could position myself for opportunities that would bring me my own sort of level of satisfaction, while also increasing my ability to be able to provide for them, because it is not easy to pay for all the things and keep them in sports and keep them sort of moving through in a healthy way. And looking at them and being like, we've got this, and never wanting them ever to feel like they have less than because of our family situation, our family dynamic. So that gave me a lot of grit, a lot of determination. And truthfully, I couldn't give up, because what was the alternative? Thankfully, they grow and they start becoming more independent. I continue to discover my own strengths and my own passion, and how my purpose can be expressed through being a mom, through being a team leader, an organizational leader. And I've really focused over the last, I would say, 5 years to try to transition from survival, fueling what I do, to this idea of thriving. And that, how I would define that, constantly evolves. But recognizing that I'm really good at this, I have something of value to bring to the people around me, to the community around me. And if I remain sort of super curious, I'm going to keep sort of finding my way to sort of what the next thing is that I'm meant to contribute to. So back to the kind of hard start, it makes you resilient. I think it makes you super compassionate. It also allows me, while I recognize, I am a white woman and I've had privilege and it's been tough, but there is a lot tougher out there. I know it's important to listen and to understand the perspectives of people around me, that I haven't walked in their shoes. I don't know what their experience is. And if it had been easy, I don't know if I would have that level of awareness. And I think the combination of those things and some others have helped me be really good at what I do.
I am going to ask you a question you might find a little bit uncomfortable.
Perfect.
It wasn't on the sheet.
Oh, good.
But it's something that you and I have talked a lot about. And,
we're both women, and we're both very curious about women and leadership, and in a super positive way that doesn't take away from men and their roles and contributions in leadership as well. But the unique situation and circumstances that we grapple with as women that are sort of pursuing leadership. And I know it hasn't been easy for you. You've often been misunderstood. And I don't think I'm out of line in saying often it is because of the way you look. And can you maybe share a little? I know she's looking at me like she's like, I'm going to kill you for this.
I wasn't expecting
but I mean,
that,
I've been with you where, and like super not intentional, well-meaning people, let's say you're being interviewed for a story in the media or this or that. And, the first thing people are like, oh my gosh, you look so cute. And it's, I don't know. I just feel like those things don't happen. They didn't happen with our previous leadership. Doug, who was a man. And I also feel like you've had to really prove yourself and your worth and your intellect and wisdom and all of that a lot. I don't know, share about that.
Okay, I was thinking like 3 different things while you were talking, and then you threw that out from sort of the side. I think there's a lot of things at play. I will just start with, being a woman, a young woman, back in the day when I was, fundraising and really working sort of on an individual level for my organization. I absolutely know and experience things, with individuals I was working with that happened because I was a woman. And I also know that I responded because of how I had been taught that I should respond, not by my mom. My mom was and is a very strong woman, but it was like hardwired for me to be polite, to be gracious, to please. And in this industry, you are trying to build relationships with people so that they will invest in something you believe so deeply in. And I have worked with a lot of really great people, but I have experienced situations that I know would not have happened if I was a man, whether it was the way I was greeted or touched or a comment about my physical appearance. I've heard more than once, oh, you're actually really smart.
Totally.
And I think to myself, really? Okay, because I also recognize we got a lot of work to do as people, as individuals. And so I think I have an individual responsibility. I've had to invest a lot in myself to develop the confidence to know how to show up in a way comfortably so that people recognize my capabilities and my strengths beyond sort of my gender and potentially my physical experience. And I also have to support and talk about these things with my female colleagues, with young women who are coming into my organization. It's kind of like going back to healthcare, to talk about all the good things that are possible without talking also about the problems that exist, does all of us a disservice. So I think that certainly there continue to be challenges, and I stand on the shoulders of women that came before me that have been strong and they trailblazed. But we need to keep in mind that it's going to take a couple generations for us to sort of unlearn what we learned as individual women, to change sort of that workplace culture that positions and can sort of treat women or men and women or people who identify differently a particular way. And the last thing I want to say about that is just because you're a woman doesn't mean in the workplace you're kinder and more compassionate. Unfortunately, another side of this, I've had some really great male colleagues who have been incredibly supportive, and I would say show more compassion and respect sometimes than women I've worked with. Women have learned how to
Survive.
Yeah. And so I look at sort of outside of gender, healthy, compassionate leadership versus toxic leadership. And so I think all of that creates a lot of complexity, but also a lot of opportunity for me to show up differently. And I hope to influence you as somebody who works with me and others to recognize it's not just about men being better. It's about women being better, society being better, men being better, and us just rethinking and staying committed to changing sort of the way that we show up and the way that we're treated.
Yeah, I love that, and sorry for going off script.
That's okay.
But I think it's a really important conversation. It's one that we often have offline as women, but I think it's important to have those conversations online, in person, and not just by making comments on social media posts and sharing other people's content, but like actually having them in real time in real life.
You bring up a good point that I really I can speak from a leadership perspective. Before I think about how we can impact healthcare, before I think about the conversations I'm going to have with a donor or community member or a partner, I think about how I'm showing up as an individual every day in this organization with the people that I work with you, with our volunteers. I feel that the influence that we can have on an individual level often goes unrecognized or unnoticed, even by ourselves. Like when I show up and I treat you with respect and I give you time and space to express your ideas and your feelings safely, when I have enough self-awareness that I recognize sort of what's appropriate to sort of be shared, how to manage my own frustration or disappointment, I think that in these conversations that we often sort of have quietly, but we don't sort of talk about publicly, is where sort of back to that idea of magic, like the real change, the real magic happens, because how you go out and lead your team, how you go out and engage in a conversation with somebody that you're interviewing, I think will reflect that spirit and that approach. And I think it's really important for us as individuals and as leaders to recognize that everything that we want to do out there needs to first start like in here, like in our...
And she's pointing at
my heart. Yes, I use my hands a lot so people can't see what I'm doing.
You do. Very expressive.
Yeah, I totally agree. And I was going to ask you to talk about your leadership style, but you've really elegantly articulated that. But I will ask you pointedly, like, what makes you different? What do you think makes you different?
I don't know if I hope it doesn't make me different, because I want to believe that there's more and more people showing up this way. But it's like heart first sort of, and I've had people say to me, it's like connection before context. And I believe I show up like that every single day. How are you versus what are you doing? Or before, what are you doing? I also believe deeply that investing in your people and the well-being of your people always will result in outstanding organizational performance. And it doesn't mean that I don't take risk management and strategic planning and our operations very seriously. I do. I protect the assets that we have and the investments people have made in us with every ounce of my professional and personal self. And I know that if I show up and I am compassionate and I'm listening and I empower and get out of the way of those who are around me and I give them the support and resources they need, our bottom line, our impact, our ability to catalyze change, it will far exceed what would happen if I solely focused on the business. And that's how I sort of define myself. And I hope that I'm not unique in that. I don't think I am, but yeah, I think it's we could see more of it.
I've certainly benefited from your commitment to that type of leadership, for sure. I think it really has amplified, my own potential. And also, you sort of talk about the impact that has organizationally, right? Not just on individuals and the people that we're in relationship with as we go about our work and our business as it is. But, like organizationally wealthy.
Yeah,
if I can come back to that, like culture eats strategy for breakfast, I think is the line.
I love that you said that because I was having a conversation yesterday and I've got one better.
Oh, good.
Culture is strategy.
Indeed.
Culture is strategy, and good culture is something that will, again, translate into the sort of excellent execution of every other organizational strategy that you have. And culture is built from the top down and the bottom up. It's everybody's responsibility, but as leaders or anybody who's in a position of any kind of influence, you need to walk that talk and you need to prioritize it. And if you think you're going to build healthy culture as a toxic leader, it's never going to happen. And I think about the amount of time that we spend together. It's 5 days, sometimes 6 days, lots of hours. I don't personally ever really turn off what I'm thinking about, what I'm dreaming about. I need to be a part of an environment and part of a team that feels good, that challenges me, that is comfortable to sort of have hard conversations, not just be able to produce great posts that people like. And it's like, that looks like it feels really good, but what does that actually mean? And I see that. You see organizations that people are not happy and they present this face of, working well together. And you talk a lot about brand.
Yeah.
And sort of that conflict that you'll see an organization sort of express or define themselves as one way. And then I'll meet their leader and I'm like, oh.
Yeah. Total disconnect.
Yeah. Yeah. And as leaders, we have responsibility, again, at an individual level. Like, am I a living example of the culture that I want sort of to create or I hope to nurture within my organization?
And, one of the expressions of that is our shifting, perhaps, ideas around what success looks like as an organization, And this is an exercise that we are currently in. We're looking at KPIs, for example, key performance indicators. And whereas in the past, it would have been sort of ratios and, revenues and all of these like horribly like accounting-based things that make me like sweaty. But now we're talking about other ways to measure organizational success.
Mm-hmm.
And how do you like measure culture shift?
That's anybody knows the answer to that. Like in just, they have a package that they could deliver. I would invite that.
Is there like a ratio?
I know. Well, there's lots of benchmarks and lots of great people and smart people trying to figure this out. I want to preface that good culture also includes accountability.
Mm-hmm.
It includes, transparency, real commitment to hard work. Like, good culture isn't just like playing ping pong and giving each other a high five and, having fun going out after work together. Good culture is doing good work and sort of advancing the organization's priorities and protecting sort of the brand and the purpose that you exist for. So I would say that your bottom line is very important. It always will be. But I want to add to it, and it's kind of that like triple bottom line. Yeah. So it's like the money that we're raising. How are we using our resources? So that sort of can identify the health or position of the organization, the wellness and the health of people. And we're starting to look through. Is it retention, or is it how engaged people are? Is it the investments we make in them, both to learn, technical skills, but also soft skills? Like, if they can learn to communicate with their colleagues better, does that then translate into their other relationships? I think so. And then the final one is that sort of community impact. Through those first two indicators that can have like 30 different data points, how does that translate out into community? And where are we having an impact, both in where we can direct dollars, because that's incredibly important. Also, the tables that we've held or the conversations that we've helped create, the number of people who've been able to come together, build relationships, and as a result, problem solve together. The connections that happen when community comes together around cancer care, or for us, like a winter wonderland that happening at Joanna's house,
or pickleball.
How do you?
We did that.
We did do that as a team building exercise. But how do you measure that? Like, yeah. And so we're trying. We'll talk about like the number of events we put on, and we'll share stories. But you need to have, like, for me, it's that triple bottom line, and they're all equally important. And if the health of people isn't there, it's going to affect your bottom line, which is going to affect your ability to create change in community.
Yeah, perfectly said.
I really like this because it's a conversation. Yes. I get terribly nervous. We talk about this all the time. Yeah. You'll say, okay, the radio's calling, and then, Global's coming to talk to you. Yeah. And I vibrate. I am so much more comfortable having conversations. I know it's an important part of what I do, but what people can't see, like when I'm doing an interview with Claudia or whoever it might be, my entire body is shaking. I keep asking myself, like, what practice do I need to figure out so that I can stop being so nervous? Yeah. But I'm just, I guess, learning to accept it. But this feels really good.
Yeah, I totally agree. And I'm so grateful we're doing it. Took a lot of courage, I think, on both of our parts. It wasn't, as we said in the beginning, it wasn't something we talked about, well, how do we raise funds with this? And thankfully, both of us were on the same page. And this isn't about raising funds directly. It's about really creating a very necessary space for people to feel like they can talk openly.
And because always, putting that other part of my hat on, creating connections does translate into fundraising.
Absolutely.
And that's what I think the other thing we've learned about our organization. Our goal isn't fundraising. Fundraising is an outcome. Our goal is to build really authentic, meaningful relationships, connections, and opportunities for people to connect. And with that, we build trust with community. And I always talk to you, like my new vision is, in time, people are going to learn about our expanded work, and they're going to know our commitment to health and the network that we've built to help drive solutions. And someone's going to walk through the door.
I love that you're saying this.
And they're going to invest, let's just say $25 million. And they're going to say, do more of that, because it matters. Because it's not one thing. It's not right now. It's right now, and it's the future of now. And it involves everybody. And if it has to do, I mean, what doesn't have to do with health? But our mandate can hold that. And again, I don't even know what question you just asked me, but it inspired me to say that.
Yes.
Because that's right. How does this translate to fundraising? And when we first started talking about it, I was like, Shauna, everything we do, we have to plug it back in. Like, what do you say?
All paths lead to God.
All paths lead to God. And so no matter what we're doing, back to strategy, we got to make sure that we're being focused and purposeful. And so
Remember the mission we're on.
on. And I love that we're doing this because, will it be successful? Will people listen? I sure hope so. I believe they will, but like, you don't know if you don't try.
And I've been thinking about this too, because like I'm a Virgo and a perfectionist, and I'm like in the podcast game. Oh, I'm also super competitive. Winning looks like having a big audience and lots of follows and all of these things. But like, honestly, and I'm saying this like truthfully, I do believe there's an audience for these kinds of conversations. But if the only thing that happens is that I have a meaningful conversation one-on-one with somebody once or twice a week, and then that leads to something else, which it will, because it always does, we've already won.
Exactly.
Do you know what I mean?
Yeah.
That's not to say we don't want anybody to listen, because we do. Everybody needs to listen and follow and do all those things. But yeah, I love sort of where this conversation has sort of wandered around to.
Yeah.
Do you have something to add there?
I do. And you can tell when I have something to add because I sit and I'm always practicing more listening.
No, but you get to talk. This is like your, yeah.
But this for me too is another, I guess, deficit that we feel in community is around relationships and relationship building. And organizations focus on a lot of things, but often don't have the resources or recognition to invest in relationships and creating connection. And I would see this podcast, it certainly is a platform. You could call it marketing and communications. You could call it a multimedia strategy. And I think most importantly, you can call it creating connection, and connection that is important to the person. Like this for me with you right now is really special. If somebody listens and they align and they hear, now this is another connection. And then if they then share it, and one day we have, who knows, 500,000 followers, 1 million, 10x it. There's this network of connection that's happening.
Yes.
And that is just awesome to think about.
What keeps you awake at night?
To be perfectly honest, everything and nothing. So my brain doesn't ever shut off. I am thinking about the next thing before we've even arrived at the current thing. I really try to allow myself to rest at night. I just tell myself I have done the best I could or I can today. There are often things that I will think about from the day. Did I say that right? Did I show up right? Have I given that person or that project enough of my time? Oh my goodness, what if all these things we're doing don't work? It's like this perpetual place. What if they do? But so I at a certain point, I have to just spend some time being grateful, reflecting. I'll often write things down that I feel like, they will be the things that will keep me up. And then I try to put my head down and just allow myself some rest so that I can get up the next morning and be present and give sort of whatever this day brings, the best part of me.
I love that. And we're talking to the sleep doctor soon for one of these episodes. So I'm sure we're going to learn why it's very important to prioritize a good night's sleep.
Oh, yes.
Yeah.
Yes.
What gives you hope?
Oh, my goodness. My children, their perspectives on the world, the next generation's perspective on the world, the people I work with every day, the community that we live in. Philanthropy gives me hope because it's evident that people will invest in something that is greater than themselves, that will benefit people often when they will never benefit. So I guess people give me hope. Their hearts, their ideas, and and just the way sort of every day, no matter what's going on, no matter how, I don't want to swear, but like crappy a day can be or a situation can be, the way that sort of people can sort of
lift one another up,
alter that perspective and that experience. That gives me hope, because it's like there's nothing then that we can't do together, even if the world and life gets really messy and hard.
Even if the robots come and take over.
I'm okay with robots. I just think that robots need rules.
Yeah, indeed. And hopefully they listen.
Allie, what areas of your health do you feel you're wealthy? In what areas? And like abundant? What areas of your health do you feel that you're wealthy?
Yeah, I keep going back. My children, my partner, my family, my friends, sort of they're at this moment, they are healthy and happy. I have a genuine feeling of happiness and gratitude that creates a lot of sense of wealth.
Is that something that you've had to learn or practice, or do you feel like you were kind of hardwired that way?
I think I have always tried to see sort of the good or the possibility, but how that would translate to me on an individual level, that's a constant practice. It's really easy to notice what's not working, what feels hard and what feels sad or disappointing, or to reflect back to different periods of my life, like, oh, I knew then what I know now, but I didn't. And so I think for me, I recognized, and I'm so privileged to be in a situation where I no longer need to worry about how I'm going to pay for groceries. Like, at a time it would have been like, I have enough money to support my kids, and I am able to, I'm just kind of going on a little bit of a rant, but I remember a dear mentor of mine, I said to her, because I didn't have a degree when I was looking at applying for this job. I had a lot of education and experience, but I didn't have like the master's degree. And I said, I don't know how I'm going to pay for it. And, it's like $30,000. And she looked at me and said, would you just apply first? You don't even know if you're going to get in. And I did. And then I figured it out through scholarships and, again, working super hard and maxing out my credit card. But we figured all those things out. So I realized that it's absolutely not money. It's this sense of feeling grounded, supported, connected, and that those around me are doing well and happy. That, to me, is wealthy, and I feel an abundance of that right now. So I'm extremely grateful.
All right, last question.
Okay.
I know that you do have a gratitude practice. I also know that you have made a commitment to kind of like working on yourself, What is a meditation or intention that you are working on in your life right now, either professionally or personally? Yeah, I love Allieisms, and I'm sorry if I'm springing this on you, but you tend to like mix metaphors.
I make up words.
Make up quotes. But they're awesome. And you are one of the best metaphor builders I've ever met. Like, you'll always be like, oh, it's like when you go to a picnic and then you'll just build this whole like analogy out off the top of your head. But anyway, I digress. It's one of the fun things that we like about Allie. Is there something that you're like a meditation or intention that you're working on in your life right now?
Oh, always. I would say the first thing that comes to mind for me is grounded. I'm grounded, and I'm exactly where I'm supposed to be. And I could unpack that a lot. I have committed and will continue to commit in sort of self. I think it's so important. If there is a PhD in self, I think I have it. Uh, and it's been a lot of different things. I remember when I first landed in this job, it was like, I belong here. I'm supposed to be here. I'm here because I'm meant to be. And that wasn't to like boost myself up. That was just to like recognize the huge responsibility I'd stepped into and just convince myself in the moment that I can drive this bus. And so I think for me right now, it's being, really grounded. And the other thing is I'm capable. When you're dreaming big, sometimes, at least in my experience, you can feel overwhelmed with sort of what you're suggesting is possible. So, those two things. But honestly, if you were to ask me next week, it might be something else. So it is just it's a daily thing. It's a absolute daily thing that, in addition to gratitude, being very purposeful around what my intention is, how I need to show up so that I can get these sort of big things happening and possible.
Well, thank you so much for being the first guest on Wealthy, and you've been insightful and vulnerable and funny, and I just really appreciate you taking the time. I'm going to say this. We learned a few weeks ago that last year, the KGH Foundation had our best year ever.
Mm-hmm.
And I think that is a real, in so much as we talked about all the other things that you can measure organizational success around, it's important to celebrate that a new era is possible when it comes to how we show up in our work, and for our people and for our communities. So congratulations.
Well, thank you. It was everyone that made that possible. And thank you for that. And for this for me also is discovering a new way of connecting that feels comfortable and just it's so incredible to dream big and then have the community really validate that with their support. And we're just getting started.
Well, that seems like a great place to finish. Thanks, Allie.
Thank you so much, Shauna.